Hello, welcome to Lipedema Link. I'm your host, Donnell Ray, and today we're going to be talking about conservative treatments for lipedema with our special guest, Sandra Dupree. But first, let's go ahead and say hello to Phil.
Hey, what's going on? Today's episode should be really fun. We do it with lipedema all the time here on the show, but we don't really talk about the conservative measures, so this should be an interesting show.
I know, and all of us ladies that have this, we all have probably tried multiple ones of these at different points in times, trying to get some relief from some treatment. So I'm so glad that Sandra has agreed to come on, and she is a physical therapist and certified lymphedema specialist therapist. So she's a PT/CLT, and she can tell us and educate us all about this. So welcome, Sandra. I'm so glad you're here.
Thank you. I'm glad I'm able to be here and talk with you today.
Yeah. So, and I like the idea, not for you, but for us, that you also are a lipedema warrior, as I call it. So you have a very unique perspective on this as well. So it's kind of like treating yourself as well as treating other people. So I'm so glad that you decided to go and share this with us. So what are conservative measures or treatments? What is meant by that term?
So conservative is really non-surgical interventions, and there is quite a variety of different things that people with lipedema have used to successfully help them with managing their diagnosis.
Yeah, and I know that just like for me, the swelling and the inflammation and the pain, you want to go and you want try different things to go and do that. So some examples, and you can kind of expand on these better than I can, but I mean, like, I know I tried wraps and, the bandages, the garments, the pumps, all of those sorts of things have done, the MLD. And I don't know if that's kind of standard of what you see and what you recommend for this. So can you just kind of enlighten us a little bit more about what those are?
Yeah, and we can break down each of the different types and talk through that a little bit. Typically, the treatment falls under complete decongestive therapy or treatment, which includes exercise, skin care, compression, and manual lymphatic drainage. There's also other aspects of care, including nutrition, mental health support, and even supplements or medications, which is probably not my area to talk about today.
That's okay. And actually in diets and stuff, we did have a dietitian come on and talk about some anti-inflammatory diets, but that is a conservative measure. That's, shy of any sort of invasive treatment like a surgery. So that is definitely on the list as well. But yeah, so let's go ahead and let's talk about then the compression.
I think the compression is a big topic for a lot of women. There's some factors that we have to take into consideration with all of the choices that are being made for the compression. So someone with lipedema have multiple diagnoses. If they have straight lipedema versus if they have lipedema and lymphedema, do they have an obesity diagnosis in addition to the others? Hypermobility goes along with it. And which compression is going to be working best for each woman or each person with the diagnosis is something very important. The compression really does help oftentimes with managing to make sure we don't get the extra fluid in the tissue or reducing that fluid from accumulating. Also can help with breaking down of the fibrosis or that more hardened, tougher feel of texture when the swelling is there or even the adipose tissue is there for a while.
I had that
and then we need to consider pain. We really need to look at what compression works best because it can help manage people's pain as well.
Okay. So when someone comes to you with a diagnosis of lipedema, what do you do? How do you start?
With starting towards just the aspect of compression or in treatment in general?
Well, and I guess I kind of got ahead of it because compression, you're going to come to that, but I guess I should have kind of say, okay, so when someone comes to you, then do you determine then is the right type of compression or is something else better, or do you do this assessment first and then kind of go from there? And I probably should have started with that.
Yeah, I think that every person with lipedema really should have a physical or an occupational therapy evaluation.
Okay.
We need to look at functional mobility. We need to look at pain management. We need to look at posture. So many aspects of just our daily mobility and our daily routines. We should also have an assessment of our volume of our arms, legs. Do we have any swelling anywhere else in the body? Is lipedema impacting our trunk? So really doing an overall assessment of the quality of our tissue and how much volume may be there from either co-diagnoses or comorbidity of lymphedema as well. Once the assessment is completed, which is usually on the first visit with anybody, and I should back up and say there's also another assessment that a lot of people with lipedema are requiring prior to surgical insurance coverage for surgical interventions, and that is a functional assessment, looking at what are the person's functional limitations, because from what I've seen, women with lipedema have a good way of modifying their routines throughout the day to manage through the pain, the fatigue, and any other of the symptoms that we're having. So really looking at that full assessment is what comes first, and then an individualized plan happens after that. In the individual,
I had that.
yeah.
I had that assessment too. Is that and that's covers many. I mean, there's a page or two or three of various areas that you're tested on. Is that the same thing that you do? It's that same sort of, I mean, it's walking and standing and lifting and
Yeah.
sort of, kind of plank positions or something on the floor and different things. I just remember it and it took a while, but it tested a lot of things.
It really does. So some people will get a functional capacity exam, which is a lengthy 4-hour testing that is done by a therapist that has certification in that type of evaluation. And it will tell you a level at which you are, your work level, basically. What level is the best option for you? Meaning, are you comparable to being sedentary, or is it heavy work? The other type of assessment that can be done is a lipedema physical evaluation or a functional performance testing, which may take an hour to an hour and a half in time. It's going to look at everything from arm strength, leg strength, muscle endurance, cardiovascular endurance, core control, balance, just looking at all of the areas in a way that really highlights or showcases some of the challenges that people with diagnosis of lipedema have.
Okay. So then you go and you perform all this, and then based on that, then you kind of go and determine the treatment. And assuming that, like you said, the compression is the first one. So then let's go ahead and let's talk about that, so that you go and you decide someone does need some compression or the decongestive therapy. So let's start with that.
So if someone is needing the decongestive therapy, we find that they have more fluid in their tissue, which is very, very common. We will do either compression short stretch bandages. There's also inelastic wraps, which are a wrap that's secured with Velcro. And the purpose of that type of intervention is to reduce the volume of the leg. We have to keep in mind that we're not going to change the volume of the adipose tissue. We are just really focusing on softening the fibrosis and helping to move the fluid that may be trapped in that tissue. So that's the first step usually.
And the bandages
from there.
Oh, I'm sorry. Go ahead.
No, go ahead.
Well, and I was just thinking about the bandages, because I know for me, it's like, people just think, oh, I can just wrap with an ACE bandage. But no, there are certain types of bandages that you have to use for that has a certain kind of, like you said, the short stretch or whatever that has to get that fluid out of there. So, yeah, I just thought that was interesting, because everyone just thinks, I'll just do an ACE bandage and I can wrap it, but it's not the same.
No, an ACE bandage can actually cause more harm than good that from doing the wraps. And we really are wrapping in a very specific manner that is, we follow some basic principles or some pretty in-depth principles, but then we're individualizing it again for each person and their leg. Are we adding foam to support? How many layers are we using? But you're always starting at the most proximal part of the body, which for a leg is the foot, and working that wrapping up towards the hip in a way that is encouraging that fluid in that body part. So our leg to move out of, for example, our foot or our lower leg and up more towards the hip, our hip, so that it can get closer to our central lymphatic system and then help recirculate out of the body.
Okay. 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 So do you almost always start with the wrapping initially?
So it really depends. Some women won't tolerate that level of compression. It is often tight. It's hot. If they have a lymphedema component, it really is a good starting place. And I recommend usually working with the person again on an individual basis. So do they tolerate less wraps? Do they tolerate only up to their knee initially? And really helping that person build their tolerance. Because we don't want to do something that is going to cause someone pain, and especially with lipedema, how sensitive our tissue really is. But some women go straight into a maintenance type of garment, which is the compression leggings, the compression pantyhose, items like that. Usually with a lymphedema aspect, we do the treatment phase, which is the short stretch of the Velcro, and we move into the management phase, which is the thigh highs or the pantyhose or the capris with knee highs. But really that, again, is going to vary based on each person.
Yeah, I know that I had started, when I first started early on, I did all the wrappings and stuff. And then I progressed on. I did the garments and then did the more medical grade even, just to try to go and get that from a maintenance standpoint to keep it out. So, and there are different kinds of garments too, and different types of material that they're made out of that maybe women can tolerate better than others. Is that true?
Yes, absolutely. And, I am one that follows the belief of some compression is better than no compression. Medical grade compression, the more distal, again, towards your foot has more compression than more proximal up at your hip. And that is to encourage the flow of lymph from your foot up towards your hip again. But some non-medical grade compression, there's all sorts of brands that women may prefer. If your ankle is the smallest part of your leg, that is going to have actually a higher amount of compression working up towards the hip, which is a large circumference compared to the ankle. So it's going to have less pressure at that point of the body. So there are all sorts of off-the-shelf athletic wear that people I've seen have had success with, Bioflexisalis, and then we go into other medical grade. And this is a huge topic even further. Is it a flat knit? Is it a circular knit? And so really working with either a certified fitter or a therapist that has the experience and can make those individual recommendations.
I absolutely agree. The circular and the flat knit are big deals, depending upon what you can tolerate. So can we just kind of define that for some women who may have heard those, and maybe they're starting their journey and they've heard those words, but just don't really kind of know what that means?
Yeah, a circular knit, in simple terms, is probably not the most scientific explanation, but circular knit is a little bit more stretchy. Flat knit is a little thicker material and less stretchy to it. Most women with lipedema are actually going to prefer the flat knit because it's providing a more consistent compression and a firmer kind of, I say firm, but also softer material sometimes. And it may be easier for people to put on and off. So at simple, a circular knit is usually an off-the-shelf product that is not made custom to the individual person. And a flat knit is typically a custom garment that is measured to your specific leg or your specific body part, that is made out of a slightly thicker, more firm type of material.
That I totally agree. I've done both. Now, just for awareness, the flat knit has a seam. So if women have a problem with the seam, then that may be an issue for them. But for me, and this is strictly for me, the flat knit was more comfortable. It is a little thicker, and yes, I am in Florida, and yes, it's very hot, and yes, that can kind of be uncomfortable. But for me, it was just a more comfortable than the circular, you know, because I think, like you said, it's probably a higher level compression, and it just made my legs feel better.
So the other thing that the flat knit does for women with lipedema or people with lipedema is it actually can help manage the fibrosis. So typically our tissue is a little bit firmer, and we may have nodules or, you know, the tissue changes that are occurring, and the flat knit can actually help to manage that. It's not going to take it away. It's not going to completely stop that tissue from occurring, but it can support the structures. It can reduce that fibrosis a little bit within our skin, and that helps us to make us feel better when we're using it.
Yeah, it does. I mean, the idea, I had to kind of, I struggle with this a little bit, is that when you think about you're in pain already, so the idea of compression and squeezing that painful tissue wasn't a great idea for me.
Yeah.
So, you know, and sometimes depending upon, you know, what kind of condition I was in that day, it was more painful than not. So, so yeah, it's that idea that you're trying to get all that fluid out of there, which will help with that inflammation, which will help hopefully with the pain. And so it's kind of a reverse sort of logic there, because it does seem to kind of alleviate it once you can go and get that.
And we need to really look at some of the other factors with each person. Like you mentioned, Florida, the heat, that your recommendation may be slightly different than somebody who's living in a colder climate, although our body's recommendation may be the same. But it's factors that we have to look into when we're trying to figure out the best plan. Other things we have to look at is if we have hypermobile joints, which is many women or many people with lipedema, when you're pulling up garments, it may cause finger pain. So looking at which garment is best, and then also working with a therapist to identify the best ways to put on that garment. I hear from people all the time that they started to get it up and they couldn't, and it was too much pain. So really learning different techniques, but then also considering each of us has different body shapes and mobility. And we have to take into consideration things like toileting, and can someone get the compression down and up easily? Do we start with something like a non-medical grade athletic compression to get someone used to wearing that every day, and then progress to a more medical type of compression that will work even better?
Oh, very valid point. Very valid. You're right. And for what works for one woman may not work for another, but you're right. It is, and it does take some getting used to. And getting them on, I'm telling you, I think I've tried every device, every lotion, every cream, short of like jumping off my roof into them. I'm not, you know, I think I've tried it all, you know, because it does take some finessing to do. And you're right. It can cause, it can hurt your hands. It can just be very frustrating. You know, and by the time you get them up, the idea of, you're right, going to the bathroom, not great.
And to look at even from a whole perspective of what we have going on in our lives. We may be moms taking care of kids. We may have pets that we take care of, family members, work. And to think about finding all that extra time to get dressed in the morning to put your compression on, really is an individual I think value that every woman has to determine what is going to work best for them and their personal situation.
Yeah, I think you're right. Is there, just from your personal experience, and because you've had this yourself, was there anything that helped, any device or any, I know rubber gloves are one thing that a lot of people use. There's some silicone, I think, lotions out there. I've had different sorts of contraptions where you roll the sock down on it or the garment down on it, and put that on your leg that way. I mean, anything that you have found just as a tip that maybe work for you?
There's different donning devices. So we can use like a non-stick pad on the floor, Dyson, that you can rub your heel on. There's different slick, if you have an open toe stocking, that's slick, like a under sock that you put on and then pull the garment up. There's so many of those things. For me personally, I don't like using the gloves because I feel like I lose that motor skill in my hand and the ability to really feel what I'm doing and have that muscle control to put the garments on. Personally, I recommend them for a lot of people. I just don't like them. I also don't like any of the glues that are used to help keep the garments up. What I found that works best for me is just giving myself enough time, starting off slowly, one leg, pulling it up to my, getting it over my foot, taking a breather if I needed to, pulling it up a little further, taking a breather. If I'm wearing pantyhose, get it up to one knee, then start on the other leg, same thing. And just do it in phases in a slow manner, and not think about the entire goal of I've got this pantyhose to put on and they're tight and they're difficult. So I break it down into smaller parts for me personally.
Oh yeah. I mean, there are times I'm trying to put that on and I'm like sweating by the time I get done. I'm like, I need another shower here because this took forever and now I'm sweating buckets.
Yes.
Yeah. So it's to whatever works for anyone. I totally, but yes, they are kind of a necessary evil and they do help.
Yes.
And it's definitely worth looking into. I recommend it and just going through the process. And I even did after that pumps. I've done the pump to the compression pump as well. Is that something that you've recommended that for your patients?
Absolutely. So the compression pump increases our independence. We're often taught by therapists to do manual lymphatic drainage techniques, but the pump gives us some time to do self-care in a non-demanding, more relaxing type of environment. And it is helping to pump, again, the fluid from again, on the leg, your foot towards that hip, which is what we're trying to accomplish. It also can help pain management and also to minimize or reduce the feel of that fibrosis as well.
Yeah, and just for anyone that hasn't done the pump yet or maybe looking into it, you have I called them my spaceman booties just for me, but these inflatable like stockings that went up to my hip and then it attached to the pump and then it kind of does what the compression does. The garments does because it just gradiates up through and kind of pushes all that fluid back up to your center. That was my experience. So
yeah, there's many different brands of pumps, lots of research on why they are beneficial for us. For me, it just gets us to slow down a little bit. We have so many parts of our daily routine as far as management of our lipedema, and using a compression pump is one of those that we can just take it easy for a few minutes, focus on ourselves, have a mental health calm down moment throughout our day, and read a book, watch TV, talk with friends or family. Just gives us that slow down moment while we're helping the body.
That's right. That's absolutely right. I mean, if I had the time, that would be my preferred method. Pardon me, honestly, because yes, you're right. Just that moment to breathe.
And I think it's important when we're talking about conservative measures. It's not just one piece of these that will, yes, everything will help. But what we're looking at is how everything combines together to help people with the diagnosis of lipedema.
You're absolutely right. Now, I don't know of any lipedema patient that hasn't done multiple of these to try to go and maintain or improve their condition. So, and you mentioned manual lymphatic drainage, MLD. And so can we talk a little bit about what that is?
So manual lymphatic drainage is a way that we are helping to activate our lymphatic system, our distal lymphatic system and our proximal lymphatic system by doing motions that will stretch the skin, pump or move with the flow of our lymph, and encourage it to go back into our central system and be reprocessed and out of our body.
Yeah, it's a very light touch because they're right underneath, right? So that was the one thing about, because when I'm thinking, it's kind of like a massage, but it's not that like a deep tissue or whatever. That can be painful. So it's just really right, very soft underneath the skin, and you kind of do them, like you said, circular motion, and then you guys kind of show us how to, where to go and move the fluid.
Yes.
Yeah.
So we're moving through a motion for our bodies. And, some countries and some people use the word massage. Here, we like to reference it as manual lymphatic drainage techniques. It is very light touch because our system is very superficial. It's in the layers of our skin. A lot of that superficial system, we have some deep lymphatics as well. The other thing to consider, yes, a deep pressure massage can be painful to touch because many women with lipedema, it is painful to just have a palpation or that squeeze on any part of our body. But we also have to look to break down that fibrosis that occurs with lipedema. Lipedema may actually require a little bit firmer type of input, and that can be personalized or individualized by a therapist.
Okay. Well, then I've heard of, is this kind of similar? I've heard of dry brushing. So is that kind of operate in the same way where, I don't know, maybe you're in the shower or just not, but you kind of still, it's that light brush on the surface of your skin trying to move that fluid. Is that sort of the same concept as the manual lymphatic drainage, but not quite the massage sort of method?
So there's not a lot of scientific evidence on dry brushing, or at least that I can find, that consistently shows that it is helpful with moving lymphatic fluids or helping with lipedema. However, if you ask many, many, many women what our experience is, many people say, yes, I have an improved pain management by using dry brushing. I have a decrease in the volume of the tissue. And they may even say that it feels a little softer at times from using the dry brushing. So the concept behind it is using long strokes from the same way we do our manual lymphatic drainage from the foot or you start proximally, then move distally, and then come back up proximally again. So if we're doing it in the same manner that you're doing manual lymphatic drainage, I can't see how it wouldn't help someone. You're just using a tool instead of your hand. It also helps with exfoliation of the skin. And since we are so sensitive to touch, just getting that consistent touch on our skin, I feel that can help with some of our sensitivities that we may have.
Okay. So is it recommended like soft bristles or semi-firm or any?
Natural, softer natural bristles is, I guess semi-firm too, usually what is tolerated best.
Okay, because we're still not trying to do it real hard. We're still trying to do that softer stroke, right? So
yes.
Okay. Yeah. Well, I'm all for anything that's going to help someone to make them feel better, and if that helps them, and whether there's a lot of scientific study or not, I say go for it. So, I think, of course, that's my unofficial, non-PT/CLT opinion, but.
Well, I think the other thing we have to consider with using something like a dry brush, if you have a dry brush on a long handle, maybe a woman with a body shape that she can't reach down to her ankles or her foot. So by having a brush on an extended handle, she may be able to do those manual techniques using that brush. Some people use other tools, but it can actually be beneficial as an adjunct to our manual lymphatic drainage techniques.
Yeah, that's a very valid point, though. You're right. Because if the bending and the stooping or the move, that's a very valid point. Very valid point. Yeah, so use whatever works for you.
Yes. Yeah. And one thing I would add is make sure you're always moving it towards the main part of your body, moving it towards your hip. We don't ever want to push going towards our foot, because we don't want to encourage that fluid to go where, like, into our foot where we're trying to get it out of.
Yeah, because aren't there just tons of lymph nodes like in our groin area? So we want to try to get everything up there so it can be pushed out, correct?
Yes, absolutely. And back into the central system, which is our deep lymphatics, which we can pump. Yes.
Great, great. Okay, so what other treatments and measures do we have? I know that, of course, exercise is always a good one, and swimming you hear about all the time when it comes to lipedema.
Absolutely. And with exercise, every person is going to have their activity that makes them feel good, and we want to go with that. So some people, it may be a stationary bike. Some people may be walking at a certain pace on a treadmill or outside. Any and all activity that we can get in that isn't causing us to have an increase of pain, that makes us feel good, is going to be really important. My exercise of choice happens to be hiking, and I just like to get out there. That may not be the best plan for somebody else. The one exercise that I often recommend for women with lipedema is aquatics. Anything, just standing in the swimming pool, walking in the swimming pool. Many reasons why the aquatics is actually a great, amazing activity. We have hydrostatic pressure of the water, which the deeper your body part is in the water, the more pressure it has. And so what does that mimic? That mimics our compression that we're wearing on land. We have the effect of water as buoyancy. So it helps lift our body and support the weight load so that we don't have as much impact on our joints. Water up to our neck is almost 90% of our body weight offloaded. Other things is balance. If you, some people with lipedema are going to have better or worse balance, but again, many things involved. But being in the water, we don't have to worry about falling and hurting ourselves. If you fall over, you're in the water, you have more of a delayed amount of time to react and recover. So a lot of things that we may not be able to do on land, we can get in the water and do.
I think that's great. So if someone, maybe they have some mobility issues, if they can get, into the pool and they can just maybe even sit on the step and maybe just exercise their legs, stretch them out or whatever, that would still work as well. That would still provide them. Okay, great.
Walking laps is going to be one of the best things, and it is so simple. But walking laps in the pool is an amazing exercise for us.
Okay. And then, of course, whatever else you can do that will allow you, whether if you can bike, like you said, or hike, or whatever you can do mobility-wise, exercise is going to try to help get that fluid moving and get, hopefully with some inflammation and some pain, and reduce that and improve it. So, yeah.
We want to remember to wear oftentimes compression while we're exercising, so that it's helping with that lymphatic flow and helping to maintain that soft consistency of our tissue. But yeah, I am a firm believer on just incorporating moments of activity throughout the day. So it's often overwhelming. Again, we have a lot of different aspects of our care, a lot of different treatments that are needed. And so I may not have an hour every single day to exercise, but if I sit down to eat breakfast and I do 5 sit-to-stands, and then I do that at lunch and dinner, I've just gotten 15 extra sit-to-stands in during the day. If I'm brushing my teeth and I'm going up and doing toe raises while I'm brushing my teeth, I'm getting exercises in. If I have a 2-story house and I have to go upstairs, just doing a few step-ups before you actually go all the way up the steps is another simple way to get in activity during the day. Women that may be sitting down all day because of a desk job, taking breaks, sit-to-stands, doing stretches, and deep breathing is something that we can do. I recommend it while people are driving. Every time you go to a light, just doing a few cycles of deep breathing. Deep breathing helps pump our lymphatic system and also helps to activate our parasympathetic nervous system, which is what kind of calms us down. But if we don't necessarily have to take a big time out of our day to do these if you're just doing 3 or 4 when you stop at a light. Another way I like to sneak in exercise before you get out of bed in the morning, doing some hip extensions, like in a bridge position, before you even stand up, getting in 5 right there, makes it a lot easier and more accessible for our activity than trying to get ourselves down on the floor. Many of us have difficulty with that movement.
Mm-hmm.
So we're getting in these exercise moments throughout our day. Now, what I'm describing doesn't impact necessarily our cardiovascular system, which is, again, really important for us to be working out and exercising that system, but it is still a cumulative of exercise throughout our days.
I think that's great advice. So, folks out there, just every little bit, a few seconds here, a minute here, a couple minutes there, whatever little bit you can do, and stuff that you're doing really anyway, but maybe you're doing more of them. The stretches, or the hip flexes, or standing on your toes and as you're brushing your teeth or whatever. Great advice. Great advice.
Thanks. Even just sitting in your chair, a glute squeeze. We can squeeze and contract. Contract and relax our glutes. You're getting a great exercise in right there.
That's a good idea too. What about when you're talking about sitting at a desk? What about the pedals underneath the desk? What about something like that?
I love that. I've even seen now desk stations on bikes. Desk stations that can be set up with a treadmill. Sit-to-stand desks are great so that we can change our position. Oftentimes it's challenging for us to sit for extended periods of times or stand for extended periods of time. So changing that throughout the day. I personally keep my vibration plate under my desk. So when I'm sitting, I prop my legs up. And so they're getting a little bit of elevation when the machine is off. And when I want to turn it on, I can get 15 minutes of vibration on my legs as well. So just easy ways to incorporate in our normal part of our days.
Oh, I'm glad you mentioned vibration plates, because I recently got one, and man, I just feel so much better using those, honestly. I just had no idea. Now, are you, if you have it under your desk, are you only supposed to do so much a day? Is there too much vibration? I would assume would maybe make you sore. I would think, because it contracts your muscles as you're doing that, right?
Yeah, absolutely. I typically wouldn't recommend. I know there's different recommendations on how much, and I am definitely not an expert in the research on it. I do know that it enables us to have improved pain management and strength by using the vibration. Personally, I would start very small amounts, maybe 5 amounts, see how 5 minutes, see how your body responds to that, and then build up. I personally would do it 1 or 2 times a day for me. But again, that's something that we have to look at and individualized. There's also other ways to use our vibration plates. We can be doing exercises on our vibration plates. We could be putting our hands down on it, sitting down on it, standing, just many, many, many ways. And most people, the feedback that I hear is it helps with their pain management, and it does make them feel stronger, improving their activities throughout their day.
Yeah, I was just amazed. I just didn't realize that I would notice such a big difference. And also good points about you can sit on it, you can just put your feet on it. For folks that maybe, like you said, have a hard time moving or can't sit down, stand for any length of time, it's, there are ways to use it and still get the effects of it.
Yes, absolutely.
Yeah. Well, what about a rebounder? I've heard that one too.
Yeah, rebounder would fall under the exercise for me. There's a few reasons why a rebounder would be great. A rebounder is not putting as much load on our joints. It's a more dynamic base. However, it does require more balance, and we may fatigue easier on a rebounder. But what the rebounder is technically, it's encouraging the lymph fluid to be pumped and moved in our system. So a lot of women have positive response to using a rebounder.
Okay. Any recommended amount of time for that a day?
I don't have a recommendation. I think everything goes back to an individual. do want to caution people that we can overdo things.
Mm-hmm.
But I am of the mindset of, we have a huge toolbox of all these things that we can do throughout the day or throughout our week that may help us. And if one day I feel like jumping on my rebounder for 5 minutes, or
Mm-hmm.
it's 20 minutes, the next day I may not get on it. I think that having all of this variety helps us to stay engaged and to be able to accomplish more and more self-care for our diagnosis.
Oh, I think that's great. I think that's great. So, and then we did talk about a little bit about nutrition, diet, anti-inflammatory. I know there's things out there that help with that. This is another sort of conservative measure or treatment. There are certain foods out there that seem to help with the inflammation and therefore the pain. So, and I know we had done a previous episode with a dietitian, Bonnie, with Crave Nourishment, who had gone over some things like that. So I think that's always a good thing to mention. What about?
Yes,
I'm sorry. Go ahead.
Oh, so I was going to say the nutrition is definitely outside of my area of expertise, and the anti-inflammatory diets seem to have a really positive impact on many people. And that's one of those things, again, some people may like this one type of meal plan for anti-inflammatory, and another one may like something that is slightly different. Figuring out with a specialist what's going to work best for you and your body, and then being able to follow that.
Yeah, I think that's critical. I think to go to someone like you, have the assessment, see where you really are with your functioning, and then go through the therapy that works best for you. And I know that for insurance companies, if you're going to get insurance coverage for surgery, then they certainly require, and different ones require different amounts of times. I know some are 3 months, some are 6 months, but they really do want to see that you have tried these conservative treatments prior to any sort of invasive, like a surgery. So I think it's critical that they go to you and then see, be assessed, see what you recommend. And that's something else too. I mean, once people come to you, then they can go and they can continue this at home if they have those means at home to do it, as opposed to continuing to go for months and months and months on end, correct?
Yes.
I mean, this is something they can go
Absolutely.
and you can guide them, you can give them a plan, they can do this at home and get the help there. Now, how long is this going to be? Do you think then that this is lifelong? These are going to be lifelong things that we have to do with lipedema?
We really do.
Yeah.
Going back to the conservative treatments and following a plan, we have an ability to learn the knowledge or gain that knowledge from a certified lymphedema or a physical therapist, occupational therapist, be able to do those things for ourselves. And maybe some people require that one-on-one care. Some people may just need a check-in. Some people may take couple of sessions, well, maybe more than a couple sessions to learn what we need to learn, and then can be doing it on their own and document it that way.
Yeah, but it's critical to go see someone like you, at least initially, to go and try to come up with what works best for you. And every plan isn't the same for everyone. I mean, you may choose or recommend a certain method. Maybe it's based on the stage they're in. Maybe they are more advanced, and maybe they need something a little more aggressive. Maybe that is what is called for in their plan. So definitely go see someone like you. I know I did. I know I've tried many of these things, and a lot of them, most of them. And, they all helped in various ways. So, and then there were certain things that I liked, of course, better than others. But yeah, I think that it's definitely worthwhile. Any other conservative treatment that we might want to discuss that we haven't already?
I think we've covered most. So CDT consists of compression, manual lymphatic drainage, exercise, skin care, and then we add in the nutrition support, more specific types of exercises that may help. I think one thing that we haven't talked about is mental health support.
Yes, ma'am.
And that is not something, again, not my area, but I think it is important for all of us, no matter what stage we're at, what type of lipedema we have. It is a long-term diagnosis. And as you mentioned before, we are going to have to do these things, probably some of these things for the rest of our lives, in one way or another. And I think everybody has a different threshold of what their body needs for maintenance. But yes, we're going to have to do these types of things probably indefinitely, again, to different levels. So that mental health support is really, really important.
Oh, I totally agree. And I like what you said about self-care for sure. I think that all falls in there. We need to go and take care of ourselves physically, mentally, emotionally. We just have to, this is a chronic condition. It can be, you can go and get it if you get it treated. Say you're having surgery and you get it, you could get it again. It's just going to be something that we need to go and be aware of, and we need to be kind to ourselves in whatever manner that is.
I really like that kindness to ourselves. I think sometimes we have some pretty high expectations. And that's something to also consider as a therapist. We often are trying to we've talked a lot about different treatments and everything, and that can sometimes be overwhelming. And giving us that grace or that in our own self-support to be able to make it and decide what's going to be best for us.
Yeah, I think so too. Well, thank you so much. This has just been invaluable information. Is there anything else that you want to leave us with, or anything that we may have missed before we let you go?
I don't really. Maybe my one last thing is the community. The community with lipedema is an amazing community, and there is the friendships and the connections that we make, and our diagnosis does bring about these positive things in our lives. It's the way that we can connect with someone. I think our community is really strong.
Oh, I think so too. And I think we realize that we have to rely on each other, because until the education is out there and the awareness is out there, in a more profound way than it is, we really do need to rely on each other. And then when we have people like you who are experts in certain areas to go and lean into you and to go and say, okay, what can I do here? And the fact that this is your profession and you've had it, what a great resource. So I totally agree. And we need to make those connections and just try to support each other.
Yes. And I feel lucky that I have the perspective of having the diagnosis and being able to work with people that have this diagnosis as well.
Oh, I think that is that's a unique, perspective to have. I mean, that's how invaluable is that? I mean, you kind of understand, you've tried on all those garments, you've done the pumps, you've done all those things that you're recommending these people. So you have a very unique point of view for that. And it's not just saying, well, this is what I've learned and this is what I recommend because this is what my job is. It's no, I've done it. And I just think that's a real unique point of view to have. So I'm so appreciative for you and for your information and for your time today. I really, really appreciate it. Thank you.
Thank you so much for having me.
Okay, Phil, anything from you?
Wow, that was a really, really informative episode. I think our listeners and our viewers are going to get a lot of good nuggets from that. But
wonderful.
For those who are watching, if you visit our website at lipedemalink.com, you can find all the episodes there. The YouTube channel is also synced to their website, and also every episode has a blog if you want to go deeper and find a little bit more information there. Sandra, thank you so much for being a guest, and until next time, guys, we will see you later.
Thank you. Bye-bye.
Thank you.